The RAR method is used to treat higher grades of hemorrhoids involving a prolapse, which needs to be repositioned inside the anal canal. The term RAR stands for Recto Anal Repair, a combination of the HAL method, as previously described, and one or more mucopexies of the prolapsing mucosa. Before executing the mucopexy, it is important to ensure that ligating of the arteries is carried out with similar care and diligence as for the HAL method alone. Only this way can we treat the symptoms of bleeding, itching, and pain successfully and achieve the same results as with HAL. Once all ligations are in place as for the HAL method, we can move on to the next step involving a running suture for each prolapse. Alternatively, the running suture can be placed immediately after the ligation using the same suture material. The mucopexy can also be performed with ease using the AMI HAL Doppler system. The AMI RAR flexi probes are made up of two components, an inner part that is connected firmly to the handle and an outer sleeve that can be rotated. The handle is moved to the starting position used for ligation. The ligation window and hence the handle point to the position requiring treatment. The RAR flexi probe must be inserted into the rectum in such a way that the prolapse can be lifted to maximum effect. As for HAL, AMI's 5/8 HAL needle is inserted into the initial stitch placed. If necessary, the mucosa can be pulled gently into the RAR probe after making the first stitch to allow more proximal placement of the second one. This results in a Z-shaped stitch. By successive turning of the handle, more and more mucosa becomes visible. Proceeding step by step is important to prevent all the mucosa falling into the probe's ligation window at once. Continuing in this fashion, the surgeon places a running suture which ends between 5 and 10 millimeters proximal of the dentate line, still in the pain-free area. The individual stitches of the running suture are placed some 7 to 10 millimeters apart, allowing room for 4 to 5 stitches in total. Once the last stitch has been placed above the dentate line, the needle is cut off and the upper end of the suture material by the initial stitch is then knotted to the distal end of the suture. This causes the prolapse to be pulled up in the direction of the initial stitch, where it is then secured in place with a sliding knot. The number of mucopexies differs from patient to patient, and the surgeon will decide how many are necessary as the operation proceeds. As a general rule, between 2 and 4 running sutures are required. However, it is certainly possible to perform more or even fewer.